Hello, my name is Tyler Ross and this is my splinting video for HSES 350, Care and Prevention of Athletic Injuries. As I told you earlier this week in email, I am currently under quarantine for 14 days due to my recent spring break travels, so I will be attempting to splint myself rather than a patient. We'll see how that goes. Hopefully all goes well, but yeah, let's get started. So we're going to start with the wrist splint, which is going to be aiming to brace an injury of the distal radius and ulna. So what we'll be using for that is we have this lovely vacuum cleaner pipe that I'm going to use for the actual structural support. I got two bandanas that I'm going to use to secure the pipe to my arm. I have this small rag that I'm going to use as kind of a grip / cushion for my injured arm, just to kind of keep that hand neutral. Have this pair of leggings here that I'm going to use for a sling, and then I have this red nylon rope that I'm going to use for a swath. So the first thing I'm going to do is I'm going to get my injured arm flat on this support pipe, and I'm going to get this grip / cushion underneath my hand to keep it neutral. The next thing I'm going to do is I'm going to take the first bandana here. Going to make sure it's wrapped nicely so it's a cleaner wrap, and I'm going to put it over top of the hand so that both ends hang down like that. Next thing I'm going to do is I'm going to get both ends of this bandana and I'm going to make an X. I'm going to feed one end through the X, and then since I only have one hand to work with, I'm going to grab one end with my mouth and the other with my free hand, and I'm going to pull it tight, and I'm going to repeat this process twice for each wrap so that I can make a as secure knot as possible. All right, so now that that is secure, we'll take the other bandana and we will do the same thing higher up on the lower arm. So again, we're going to make an X, feed one end of the X back through, pull it tight, rinse and repeat. All right, so now that those are done, the purpose of those two wraps, you'll notice I have one on my hand and one on my lower arm. Those two wraps function to stabilize the wrist joint because the break is on the radius and ulna, which is between the wrist and the elbow. So for the splint to be effective, you want to stabilize the wrist joint and the elbow joint. So these two wraps plus the metal bar serve to stabilize the wrist joint. As for stabilizing the elbow joint, for that we will be using the sling and the swath. So as I said before, I have this pair of leggings, which as you can see I've already tied the legs together, and that is going to serve as the sling. So what I'm going to do is I'm going to take this knot, I'm going to get my arm through there, I'm going to get it over my head. Now it's underneath, get that wrap back in the right place. And then can stand up, and you can see that that sling, for the most part, keeps my arm at a 90-degree angle right there. And that will help to keep that elbow joint from moving too much, and that will help to stabilize the break. So to further stabilize this, I'm going to grab this red nylon rope that I talked about before, and I'm going to swath this sling. So that means is I'm just going to make a tight wrap that's going to help to keep it, the sling and my arm close to my chest, and that's going to further minimize that elbow movement. So step one of this will be to find one of the ends, which we got. I'm going to feed it underneath the sling here, just to keep the this loose end stable. And then I'm going to start kicking this around my body lifting it up with my foot. I pulled it out. We will start over. So again, we're gonna insert this. I'm actually gonna tie it off this time so that doesn't happen again. All right, that should keep it secure for now. Then we'll just start to, oops, probably stepping out of frame there. We'll just start to kick this rope up and wrap it around, all while trying to keep this lower arm as stable and level as possible. I have enough rope for one more wrap. All right, so we'll get this higher up on the arm, pull it tight, give it a couple good wraps just for stability. Maybe tuck it back through, pull it tight. Do that again. So that should be pretty secure. And we'll just slide this rope further up so it's around my chest. And there you have it. So, just to rehash what we've done here, you have this vacuum cleaner pipe with the two wraps, the one on the hand and the one underneath the sling with the red bandana. You can see the ends there. Those are serving to stabilize the wrist joint, which is going to be the joint that is distal to the brake, and then, or distal to the body surrounding the brake. And then you have the sling and the swath, which is going to be the it's going to stabilize the elbow, which is the proximal joint surrounding the brake. And yeah, that is my broken wrist splint. Now we will go on to the lower leg splint. Alrighty, so for this injury, we will be splinting the lower limb, operating under the assumption that I have broken both my tibia and my fibula. So as I said before, you want to be stabilizing the joint on either side. So I'm going to be using these collapsible curtain rods. So as you can see, they lock pretty well, but I can turn them and adjust length. So what we're gonna do here is we're gonna have one on the inside of the leg. Back up a little, make sure you can see everything. We'll have one on the inside of the leg, so the medial aspect of the leg, and then one on the outside of the leg, so the lateral aspect. Then what we're gonna do is we're going to have two wraps below the knee. We're gonna have two wraps above the knee. And both of those wraps are going to help to stabilize the knee joint and the ankle joint. So this pulls, as you can see, run the full length of my leg. So the wraps on my lower leg, or just my leg using anatomical terminology, will be used to stabilize my ankle joint by tightening the curtain rods closer to my ankle. And then the two wraps, which are shirts in this instance, are going to be the ones that are on my upper leg or thigh, are going to be used to help stabilize my knee joint. So once I get these threaded through, I will tie them off and we'll have the splint. Okay, so like I said, we have two wraps on either side. So we're gonna start with the lowest one down here. We're gonna pull them up so that way the rods are as close to center of the leg as possible. What I mean by centered is like not too anterior or posterior. This will be a little easier because I have both hands this time too. So we'll cinch that up, pull that up slightly and cinch it up again. Then we'll go to one of the upper ones just to kind of get the orientation of the poles correct. We'll cinch that up. Cinch it again. Now we'll come back to the second lower leg. Tie that nice and tight. And then we'll tie this one nice and tight. And there you have it. So my knee is right here. If I were actually injured, I would not just grab my knee, but my knee is right here. And as you can see, we got 2 support straps above, 2 support straps below. So these rods on either side are both helping to stabilize the knee and the ankle, which are the 2 joints that are on either side of the break, which is tibia and fibula. The 2 distal wraps are helping to stabilize the ankle with the aid of the poles, and the 2 proximal wraps are helping to stabilize the knee with the aid of the poles. Something that I did not talk about in the first splint or this splint is, in both cases, if you were splinting somebody else, you would want to be asking them if they're feeling any tingling in their limbs, or perhaps pressing on nail beds to ensure that you're not cutting off blood flow or any kind of circulation. Since I am the patient in this instance, I don't need to ask that of myself because I can feel that there is no cutting off of circulation, no tingling or whatnot. But yeah, that is my leg splint, and thank you for watching.